My name is Dr. Brady Wyrick. I'm thrilled that you're here. I'm the clinical director here at Intermountain Regenerative Medicine. We have clinics our main clinic is in Idaho Falls, Idaho, and our secondary clinic is in Bountiful, Utah. I'm very excited to share this message with you tonight. There's a couple things right from the get-go that I want to go through, and these are our disclaimers that we share. Our disclaimers are this. Number one, we're here for educational purposes only. This isn't a sales pitch. This is just me. I'm just going to share with you what our, the information that we have. Now, that being said, though, when we get towards the end of this thing, what I'm going to do is I'm going to post a link that will take you where you can actually schedule a one-on-one phone consultation with me, and you'll be able to go through and ask the very specific questions to figure out whether or not this is right for you. So there's the only sales pitch I'm going to give you tonight, and that is if what I say makes sense, then you will have a link that you can schedule a free phone consult so you and I can just sit down together and talk. Okay? Second thing is that the stem cell therapy is not approved by the FDA. That means that I cannot sit here and tell you, yes, it's clear, it's approved, it will treat this and this and this. I can't do that. Now, the FDA has cleared it. That way we know that what we're doing is safe. And as long as you follow the FDA's protocols that are in place, that assures that everything will be safe and on the up and up. So the third thing is Intermountain Regenerative Medicine is a medically integrated clinic. By now, most of you have Googled my name. You'll find out that I am a licensed chiropractor, even though I do not practice anymore. My job in this business is to help to educate you so you know what your options are. So my job is in education, it's in research, and kind of just overseeing the entire operation. We do have a medical staff that does that actually performs the injection. In fact, the running joke around here is that on injection day, I'm typically not even here. So our nurse practitioners will perform the injection, so it's not me doing the needles, which is a very good thing. So, last thing is that we utilize stem cells that are derived from donated human umbilical cords without question on a day-to-day basis. Someone ultimately asks me if the cells that we use come from aborted babies, and the answer to that is absolutely not. These cells are from donated umbilical cords. The cells themselves have been washed. They've been screened. That way we know that what we're using to inject our patients with is of the highest quality and of the highest safety standards. So that's the disclaimer. And I've noticed since going through the disclaimer, the number of people that are jumping on board is increasing, not decreasing. So that's good. That's the disclaimer. Let's jump right into this. Now, normally what I would do is I would go in, if we were doing a live seminar, if you were here in my office or if we were in one of the towns that we do visit, we would get into the testimonial stories and talk about all these awesome things that we've had happen. Tonight, I'm not going to do that because this is a webinar, and I know that I have your attention for about 3.4 minutes, which means I got to get my point across very quickly. Every single one of the stories of these people that you see here, they are on my website. If you have not been to my website, it is iamregen.com. In fact, I think, Dave, you're online with us, right? Aren't you on there? Why don't you go ahead in the comment box and just put the website there. I invited Dave to come with me. He's our stem cell coordinator. And I did that really because I hate being here in the building by myself and talking to the computer without interaction. So I've got Dave here to help me out with those little things. So if you want to see these stories, then go to my website, iamregen.com, and have a look. They're all there. We're going to skip them for this evening, and we're going to jump right into what is a stem cell. Let's talk about what that definition is. So stem cells, I love this particular article because it talks here about says that stem cells have emerged as a key element of regenerative medicine therapies due to their inherent ability to differentiate into a variety of cell phenotypes, thereby providing numerous potential cell therapies to treat an array of degenerative and traumatic diseases. So what in the world does that mean? Here it is in English. This is the best definition that I've seen. I actually got this from a patient. Thanks for posting that website, Dave. The definition that I've seen that I absolutely love is this. Stem cells are blank slate cells. So right now, sitting inside of your bone marrow, inside of your fat tissue, you have this blank slate cell that is your body's own natural reparative mechanism. So you talk about what is a blank slate? A blank slate is just a blank sheet, just it's started from scratch. So right now, these blank slate cells that you see up here at the top, these mesenchymal stem cells, they are blank slates that are sitting inside of your body's stores waiting to be used when you get injured. So when you get injured, these blank slate cells will be released by your body, and they're going to go to that site of where that injury is, and they're going to do three things. Number one, they're going to start knocking the inflammatory process down. By the way, inflammation is what we call a chemokine, which basically means that it's a chemical messenger saying, hey, stem cells, come here and help. So the stem cells will go to the site. They'll start knocking the inflammation down. That's number one. Number two, they help to modulate and regulate your immune system to control that reaction. And then number three, they start to regenerate and regrow actual new tissue. So up here at the top, you have the mesenchymal stem cells. That's the blank slate cell. So when you get injured in your muscle, guess what those stem cells become? They become muscle. When you get injured in the tendon, guess where they become? They become tendon. When you get injured in cartilage, what do they become? Cartilage. To be more specific than that, when you have a tear in your meniscus, guess what those stem cells become? They become that meniscus. So a stem cell, when someone asks you what a stem cell is, they are a blank slate cell. Those cells are your body's natural reparative mechanism. They have the ability to actually regrow and to regenerate new tissue, which sounds really good, right? So why is it then as we age, why do we lose that ability? Why do we degenerate? So let's look at some factors here. Number one is the number of stem cells that you have. At birth, we only have 1 out of every 10,000 cells is an actual stem cell. As time goes on, that number drastically drops off. So by the time we hit the age of 80, which my face here is covering up this part of the slide, but by the time you hit the age of 80, that number drops all the way down to 1 out of every 2 million cells is a stem cell. So you look at it this way, a newborn baby, why do they have so many stem cells? Well, they've got to go from this big to this big really fast in order to survive. And as we age, and you think about someone that's in their 80s, why is it that someone in their 80s, when they get a bruise on their arm, why does it last forever? Why does it take weeks and weeks, sometimes months and months for those injuries to heal? They just don't have that natural reparative mechanism. So what if then you get somewhere here in the 50-year range and you have some sort of traumatic accident or high stress or some other thing that happens, you're going to use up your stem cell supplies and all of a sudden you don't regenerate like you used to. I hope that makes sense to everyone. I can't see you because I can't see how if you're understanding what I'm saying. But as we age, the number of stem cells that we have available to us rapidly decreases. The other issue that we have at hand is as we age, our stem cells' ability to regenerate, to replicate, also decreases. So a newborn baby, their stem cells are going to replicate about every 28 hours versus someone who's 80, they're going to only replicate about every 60 hours. Okay, so when it comes to talking about using your own stem cells, we have to talk about not having as many as you used to. You also have to talk about they don't regenerate as fast. Okay, so I hope that makes sense to everyone. So next up, let's talk about what these things actually do. I borrowed this. Well, okay, I didn't borrow it. I took it. They gave me permission. I took this particular image here from Predictive Biotech. This is a piece of cartilage or a piece of tissue. As we age, this healthy tissue. So these little the blue here indicates that we have healthy tissue. As we age, that tissue starts to break down and starts to become dysfunctional. So when it becomes dysfunctional, what do we typically see? Well, pain. Pain is our body's own response to an injury to let us know that, hey, something's not right. So at this point of the story, when that tissue breaks down, an X-ray might look something like this. Okay, this is a knee x-ray of this is actually a 54-year-old male that walked into one of my colleagues' offices. Okay, and we have the top part of the knee here and the bottom part of the knee, and the space between the two is about 2.8 millimeters, otherwise known as a bone on bone. So when our joints start to feel like this, we typically will go to the doctor. Well, first off, we'll typically start to take some sort of anti-inflammatory, which isn't a bad thing because it stops the pain. Hey, but when those anti-inflammatories stop working and start decreasing, or their effectiveness starts decreasing, we take more and more, or we try a different anti-inflammatory, or we go to the doctor and get something even stronger. Okay? Again, nothing wrong with this mechanism. This is the gold standard right here. Okay? They're just masking the inflammation. They're masking the pain. They're not getting to the root of what the actual problem is. Okay, so when the drugs stop working, that's when we go in and we get the steroid injections. Again, that's great because it helps to decrease the inflammation, decrease the pain. But those steroid injections, the reason why you can't get them over and over again is because, yes, they do lose their effectiveness, but they actually break the tissue down, making this whole process worse as time goes on. Okay, so what do we do next then? Well, the next option would be, when you can't drug it anymore, that's when you surgically try to replace it. And again, it's just, there's nothing wrong with that particular model. It's just that now there's a different option. There's a different alternative. So the alternative that we're talking about today then is introducing what we call human cell and tissue products, otherwise known as stem cells. And the way I like to put it is stem cells is kind of like the term Frisbee. Well, when Frisbees first came out, they were these flying plastic discs. And there were a lot of different companies other than Frisbee that were making these flying plastic discs. We just happened to lump them into this term and call them Frisbees. And everybody knows what a Frisbee is. Okay, well, human cell and tissue product encompasses a whole bunch of different types of cells, different types of cytokines, etc. And we have a tendency of lumping them into stem cells. Okay, so when we introduce this stem cell model, basically what happens is you take a joint like the one I showed you. You take this joint here and you inject these stem cells that are coming from donated umbilical cords. And what they're going to do is they're going to start to lay down some of those different types of Frisbees. Okay, some of those different cytokines, anti-inflammatory cytokines, growth hormones. But most importantly are those mesenchymal stem cells. Because you remember back to that picture that I showed you of the blank slate? And when you get injured, what do those cells become? This is what's happening here, is if this is a tendon, these cells are starting to lay down and actually starting to help your body grow new tendon, new cartilage, repair those injuries, repair those tears, etc. Okay, so that eventually, this is that same patient. This is 4 weeks after that patient was injected. 4 weeks later, that space had gone to 5.3 millimeters from 2.8, which means that we're growing new cartilage in that joint. Okay, now we continue down that path, and that tissue continues to regenerate. And we get to 8 weeks after that particular individual was injected, and now we're at 6.1 millimeters because we're growing new cartilage. This knee does not hurt as bad as it used to, but most importantly, this particular knee is more mobile, and moving joints are happy joints. I hope that sinks in. All right, moving on. Here is that same X-ray series side by side. So we have 2.8 millimeters, 4 weeks later, we're at 5.3 millimeters. Then 4 weeks after that, so we're 8 weeks after injection, we're at 6.1 millimeters because those cells are helping to regrow and regenerate new tissue. So in the research, this is what it looks like. Intra-articular injection of mesenchymal stem cells for the treatment of osteoarthritis of the knee. A proof of concept clinical trial where they injected 18 patients, followed them up with 6 months later, and guess what? The size of the cartilage defect decreased while the volume of the cartilage increased, otherwise known as they're growing new tissue. Okay, so when your doctor says there's nothing out there that can grow new tissue, here's the article you show them. Now, what I normally do is at this point is I would show a video of my dad actually pedaling his bike. He had 2 knees that were bone on bone. He was scheduled to have his first surgery, replacement surgery. We injected him, and like 5 weeks later, the guy is riding his bike again. It's an awesome video, but I took it out of this because, again, we're just trying to keep things nice and concise tonight to keep you your time is valuable. We want to keep your attention, so we won't go off this too far. So this chart is really a chart of where regenerative medicine has been and where it is today. And let's just start over here on this side. Remember I talked about all the frisbees? Well, here they are. Those frisbees include general cytokines, growth factor cytokines, scaffolding cytokines. You think about a tendon, you think about a construction site going up around a building, they build this scaffolding so they can put all the pieces in. That same thing happens with your tendon and your cartilage. So scaffolding cytokines, homeostatic cytokines, keeping things all balanced. And then finally, mesenchymal stem cells, which are the blank slate cells, viable MSC counts, and then biologically young source. So we look at this chart. We'll start here on the left. The pharmaceutical industry, what do they have to offer us as far as any of these regenerative properties? Basically nothing. Yes, there are some medications that can induce general cytokines, but they really don't have an option as far as regrowing new tissue. You guys know this because you've been to the doctor, you've had those x-rays done, and every single one of you heard this line. Well, just wait till you can't walk anymore, and or wait till you can't sleep anymore, then call me and we'll replace it. Or I think I had 2 people in their 40s this week that told me their doctor said they were too young for a replacement therapy. Of course, I said, I agree. But that's because this is what they have to offer. So from there, they went to peripheral blood. So they started using PRP. I think PRP is awesome because so PRP, they take your blood, they spin it down, and then they will take the proteins from that blood and re-inject them into you. And those are the cytokines that help start to build things. And then, where am I going with that? But you lose that ability to regenerate new tissue because you're not introducing new stem cells. PRP will actually stimulate your own stem cell growth. So we went from PRP over here to what we call autologous stem cells. Autologous stem cells is basically where you go and take your own stem cells either out of your blood, out of your bone marrow, or out of your fat tissue. So you take them out, you concentrate them, and then re-inject them back into you, which is awesome because, yes, it is stem cell therapy. But remember what I said a few minutes ago. It depends on how old you are. So when someone comes to me and says, my friends tried stem cell therapy, it didn't work, I ask them what kind of stem cell therapy they did. It's usually they did their own and they were advanced in age. Can I say it that way? They were older, right? Because your own cells don't regenerate as fast. Now, so we went from allogenic stem cell therapy over here to the placenta, which had some awesome things for us. And we really started to see a lot of great hope because we were getting some of these brand new biologically young growth factors. But what they lacked was the mesenchymal cells. So we went from there, we went to umbilical cord, which we saw a lot of great things with the umbilical cord because they helped with growing new blood vessels, new blood tissue, etc. But from the umbilical cord blood, we went to the actual matrix. So if you look at a umbilical cord, you've got an artery and 2 veins coming down the umbilical cord, and then you've got all these support tissues that are surrounding it. And we now know that support tissue is the richest source of the actual mesenchymal stem cells that are a biologically young source. So this umbilical cord matrix from these donated cords, no, it's not the fountain of youth. I don't want you to think that I think that way, but this is where all the healing properties are actually coming from. So when we talk about what types of cells we use, they are umbilical cord cells that have been screened. So healthy mom, healthy baby, they've been through the process of the FDA's clearance, so we know that they're safe and viable for use. So Moving on, what else can stem cells help with? We've talked a lot about joints, so I'm going to review this part of it really quickly. Osteoarthritic joints are our number one target, especially those bone-on-bone cases of shoulder issues, hip issues, knee issues. Yes, we can help people with spines. We do not inject directly into the spine. We inject into the muscles above the spine, and those cells find their way into the spine. We've helped a lot of people with back pain. Hands, feet, osteoarthritic joints are the number one target, but there are other things that we have seen help with. This particular case right here was a gentleman with psoriasis. His name was George. He walked into our office the day before the day of injection. This is what his knees looked like. 14 weeks after the injection, you can see that autoimmune issues have resolved substantially. So they can help with some of those other inflammatory conditions, but it all just kind of depends on what you expect. That's why we're saying, hey, what I say, if you like what I say, then we want to get you hooked up with this phone consult. So there are other things, but the main target that we're looking for, the main thing we want to help people with is osteoarthritis. Here is a study from the human umbilical cord mesenchymal stem cells for active rheumatoid arthritis. The treatment induced a significant remission of the disease according to the American College of Rheumatology improvement criteria. So yeah, there are a lot of other things that stem cells can help with that they're showing some promise with. And we've seen them here in our office. So if it's something other than osteoarthritis, let's have a conversation about what's going on with you. So a couple more basic questions and then we'll get finished up here. Number one, does it hurt? It's an injection. Dave's pointing at his shoulders right now because we injected Dave. When was that? 1 week ago, Dave got his shoulders injected. Did it hurt?
No.
The IV, I did an IV when I started this about a year and a half ago, and I don't like needles. So, yeah, there was a sting. Dave says he didn't feel it at all. I've had 85-year-old women say they didn't feel it at all, but it is an injection. How long will it last really depends on the individual. So if you grow a bunch of new cartilage and then not take care of yourself, your body's going to break that cartilage down as well. But we will give you some guidelines on how to make it last as long as possible. That takes us to the next question of, is stem cell therapy right for you? There's really three basic components to this. And again, what I'm going to do is I'm going to go ahead and post the webinar, or the link now to get you set up for the consult, because these are the things we want to talk about at the consult. And if I can make my computer work, we'll be in good shape. Well, maybe I will. It's being picky here. It says that it's copied. Sorry, guys, another technical glitch. Steve, I will get to your question. It's coming. I am not getting a paste option. Here, I'll put it in the comments. There's the link to get the actual to get the consult set up. So during this consult, this is basically what we want to talk about. Whether or not this is right for you. Hey, number one is your overall health status. This is where we're going to talk about your height, your weight. Yes, I'm going to ask you how much you weigh. And I want to know what medications you're on, because the more meds that you're taking, the less likely it is to affect what you want it to affect. So those are things that we need to talk about. Your mental mindset is also something we need to discuss. What are you expecting? Are you expecting to get injected and then ride off into the sunset doing cartwheels in the parking lot, be 25 again? Or are you happy with a 50% improvement in whatever your symptoms are? We need to discuss that. Then lastly, the financial part of this. The financial part of it really comes down to you. This is what it costs to do an injection. So if we're talking about doing one joint, think 1 cc or 1 cubic centimeter. 1 cc is $4,250. 2 joints, if we inject 2 joints, then it's $67.50. If we inject 3 joints or 3 cc's, then it's $92.50. So when we sit down and do this consultation, and again, I posted the consultation link in the chat. If we do this consultation, then what I'm going to do is I'm just going to start off by asking you what your number one goal is. In fact, when you click on that link, it's going to ask you a couple questions about what your goals are. So we kind of know where we're at, because if it's a knee, then we start with a knee. If it's both knees, then we can start with one knee now. We can do one knee later. This is not FDA approved. It is not covered by insurance. Therefore, the payment options are basically cash, check, credit card, your health savings account, your flex spending account. We can use them. We do have some financing options available. I need to take that OAC part off of there, because even with bad credit, there are some options for you. But here's the deal, okay? I tell people this all the time. Don't spend your last dollar on this. And the reason why I say that is because if you are out of money, what is that going to do to your stress levels? It's going to drive them up. And if you just spent your last dollar on this and all of a sudden your stress levels go up, then all of a sudden you start thinking, I shouldn't have done that. I've wasted my money. And you kind of get into those loops. So we'll talk about that when we do this consult, about kind of where you're at and what you're hoping to accomplish, whether or not this is feasible for you or not. But there's the financial part of this. So that brings me to the last part. That's what's next. What's next is to click on that link. I'm going to try this one more time to put this in a different spot. So if you'll click on... Oh, that's why I couldn't paste it, because I was hitting the wrong. There you go. Up there at the top, you have the Calendly link. This is what we're going to talk about. We'll talk about your areas of degeneration. We're going to talk about your strategies, whether we're going to do into the muscle or if we're going to go straight into the joint. We'll talk about your cost options, answer all your questions. We want to have your spouse there involved with this process. Then talk about scheduling and timing. Scheduling and timing is very important, because it does take about 6 to 8 weeks to really start to notice a difference. And also, we have to talk about what your limitations are for those first 8 weeks. And these are definitely different for everybody. What your limitations will be based on where you're at now physically. So we'll discuss all of that at the actual consultation part of this. That'll help us understand whether or not that's right for you. Now, here's the last thing. If you go and click on that link now, what we're going to do is we're going to give you $400 off your first injection. But we got to get that scheduled in the next 24 hours. You got to keep your appointment. I do live in Idaho, so when you schedule that phone consult, I'm going to be personally calling you, and I typically will call you from my cell phone. So if you see that Idaho Falls number calling, please answer. And then lastly, to use that voucher within 90 days. So I've been through everything that I wanted to cover. Hopefully we've answered all of your questions. We will record this and send it back out tomorrow because of the technical difficulties that we had at the beginning. Guys, I really appreciate you joining me. This has been great, and we'll look forward to chatting with you with that consult. So we'll leave that consult up there for a little bit, and we'll make it available to you tomorrow as well. So thanks a lot, and we will talk to you guys very soon.